Good afternoon and welcome to the COVID-19 media briefing. Up first, we have Mayor John Tory. Go ahead.
Thank you, Lavin, and good afternoon. We are continuing to make progress getting residents vaccinated. Almost 83% of eligible residents are fully vaccinated, and more than 87% of eligible residents have had at least their first dose. Our Shop and Vax 2.0 campaign over the weekend saw 1,434 people receive their first, second, or booster dose at 24 easy-to-access locations across the city. We know that when it is easy to get the vaccine, more people get vaccinated. That is why we've administered more than 4,000 vaccine doses in TTC clinic stations, and it is why we'll be ramping up those efforts this week across our transit system. I'm proud to announce today our Vax in the 6 campaign will be running from Thursday to Saturday. Vax in the 6 will see 6 clinics operating at 6 TTC stations, the largest number of TTC clinics we've had up and running at any one time. Clinics will be operating from 8 a.m. to 8 p.m. in Islington, St. Clair West, Union, Kennedy, Finch West, and Bathurst stations. This is possible thanks to our Team Toronto partners at the TTC, Toronto Public Health, Michael Garron Hospital and the Toronto East Health Network, and Humber River Hospital. These 6 subway locations are accessible and have been chosen by Toronto Public Health using our Team Toronto mobile data to remove barriers and bring vaccines directly to residents in areas with low vaccination rates. No appointment is needed. If you're born in 2009 or earlier and need your vaccine dose, come to these stations and get vaccinated. And again, they'll be operating from 8 a.m. to 8 p.m., Islington, St. Clair West, Union, Kennedy, Finch West, and Bathurst stations. We're continuing to get people vaccinated because we know the vaccines are our best way out of this pandemic. I know we're all watching closely the case counts and hope that we can get through this 4th wave as quickly as possible. We are making good progress. We have vaccinated millions, and we are just down now to thousands left to get vaccinated to reach our target of 90%. 2 months ago, on August 15th, there were 409,000 people to be vaccinated in the City of Toronto for us to reach that important 90% goal. Of those, 194,000 people already had 1 dose. 2 months later, at the present time, we're now down to less than 215,000 people to be vaccinated to reach the 90% goal. And we know there are already 123,000 of them that have had 1 dose. Yes, the progress is happening at a different pace now that we have literally millions who are already vaccinated, but we continue to move forward to get closer and closer to a remarkable 90% vaccinated, something that's never been done before in our city. And our subway station campaign this weekend represents one more important opportunity, one more important step. We also want to remind people today that the walk-in city-led clinics are still open Tuesdays to Saturdays at the Cloverdale Mall, the Metro Toronto Convention Centre, the Mitchell Field Community Centre, the Scarborough Town Centre, and the Woodbine Mall. I know these messages encouraging people to get vaccinated are repetitive to some and maybe tiresome to some others. That's likely because you've already done the right thing if you find them that way and got yourself vaccinated. But we are so focused on continuing to reach out to people who aren't yet vaccinated to encourage them to get vaccinated, to protect themselves, to protect all the progress that we've made so far. And we will not give up on helping them, and in turn helping them to help all of us, and to help our city to recover and to be strong and to be healthy. So please, if you're not vaccinated yet, get vaccinated at one of our Vax in the 6 clinics at the TTC stations this weekend, or one of the other clinics that I've mentioned, the other Team Toronto vaccine clinics. And again, you can always go to toronto.ca to get information on the various clinics and their hours of operation, and in most cases, you don't require an appointment. Now I'd like to invite Dr. de Villa to deliver her report and provide an update on the important work that is underway so that we'll be ready to help children 5 to 11 get vaccinated. Long before there was even any prospect of this happening soon, we started to do the work and started to get ready. And we're doing everything as a city that we can to be ready at the time that this is approved by Health Canada. The COVID-19 vaccines are safe, and they've already helped protect millions of teens, adults just in our city alone. Helping young children get vaccinated as quickly as possible will make sure they have the best protection possible against COVID-19, help to keep our schools safe and open to in-class learning. Now, Dr. de Villa.
Thank you, Mayor Tory, and good afternoon. Today, our case counts in Toronto remain relatively low, even after in-person learning for tens of thousands of students has resumed for a number of weeks now. This is cause for cautious optimism, while we are still waiting to see the full impact of Thanksgiving on the rate of COVID-19 infection in our community. With this in mind, there are a few things I would urge you to start thinking about and acting on in the coming weeks. First, flu shots. When they become widely available in November, please get one. As usual, Toronto Public Health will run campaigns and clinics, including in Toronto Public Health mass immunization clinics. This is in addition to all the flu vaccines that will be given at pharmacies and at doctors' offices. You should also know that it is safe to get a flu vaccination and a COVID-19 vaccination, even a third dose of COVID-19 vaccine if you're eligible, at the same time. Second, if you're a parent or guardian of someone aged 5 to 11, I ask that you think about getting your children vaccinated once vaccine is approved for this group, as we hope it will be in the coming weeks. Like the flu shot, this is so important because protecting children through vaccination provides a protection that extends well beyond them and will contribute greatly to ending the pandemic. Anticipating the approval of vaccination for children aged 5 to 11, Team Toronto is planning a multi-pronged campaign with partners, including Toronto Public Health and the City of Toronto, pharmacies, Toronto's hospitals, Ontario health teams, family doctors, pediatricians and other clinics, vaccination teams, specialists in children's health, and representatives of the school community. We are considering the best locations to deliver the vaccines across the city. This may include mass immunization clinics, community-based clinics, and school-based clinics, in addition to delivery through pharmacies and doctors' offices. To support the vaccination of the 5 to 11-year-old population, Toronto Public Health is launching a toolkit for parents, guardians, and caregivers. The toolkit provides reliable information that addresses how to get children vaccinated, questions of risks, the certain benefits, vaccine safety, side effects, talking to children about vaccination, and questions around reproductive health. Community town halls, telephone town halls, and parent information sessions will be offered in the coming weeks. And we will continue to add resources for parents and physicians in the coming days. What is most important to me today, as we talk about what we are planning, is to say that most parents are naturally comfortable with the practical and established practice of vaccinating children against illness. It's something we've done all over the world for decades. However, in the world of social media in this pandemic, this usual practice sometimes becomes clouded. So it is important that those with questions are able to get reliable answers to them, to fully understand the protection that comes with vaccination. The vaccination of children aged 5 to 11 is safe, protective, and necessary. It is widely believed that children do not experience COVID-19 illness the same way adults do. Typically, this is true, but it is not guaranteed. Alberta Health recently released figures showing that since September the 1st, ICU admissions of children sick with COVID-19 in Alberta have increased by 23%, and that hospitalizations of patients aged 19 and under are up 24.5%. This is the reality with COVID-19. If you give it the opportunity, if you are not protected, the virus will seize that opportunity to infect, whether you are younger or older. There remains a chance that you can be vaccinated and still contract COVID-19. If that happens, if you're vaccinated, it's more likely than not your illness will be mild and you will recover. So if you have a child who will become eligible for vaccination in the coming weeks, please get them vaccinated. You are protecting them, you are protecting your family and yourself, and you are protecting grandparents and elders who could become sick and be at risk as a result. With that, I'll now turn it over to Lavin to take and moderate questions.
Thank you, Dr. de Villa and Mayor Tory. We will now take questions from the media. As a reminder, it's one question, one follow-up. We will unmute you when it's your turn. And just so everyone's aware, we do have staff from a few divisions, including MLS, Long-Term Care and Senior Services, Toronto Police, Housing, Transportation, and PFNR if you do have any technical questions. So first up is Mark Douglas from City News 680. Go ahead.
Thanks, Lavin. Question for Dr. de Villa. With the vaccination of the 5 to 11-year-olds, are you at this point expecting only the Pfizer brand vaccine to be available to that age group? And does the city have enough supply already of that brand of vaccine for all the kids in Toronto, or are those doses sort of in the mail or on the truck and on the way?
Well, Mark, I don't know that I have the complete answer to your second question, but let's start off, with the notion of the 5 to 11-year-olds and the vaccine and who's got it available. So as far as we know at this point, it is Pfizer that has submitted to Health Canada for approval for vaccination for 5 to 11-year-olds, and it's that approval that we're hopeful to receive in the weeks to come as Health Canada goes through its process in order to ensure that the vaccine is appropriate for use in this age population. When it comes to the product that is available, as we understand it, there is a pediatric version of the vaccine, and we will wait to hear from our federal and provincial counterparts ultimately around what the supply is and what we might anticipate here in Toronto. So at this point, I don't have specific information, but as you can well imagine, there's certainly a great deal of hope and anticipation as that submission has been made by Pfizer to Health Canada.
Follow-up? Mark?
There we go. Thank you very much. That was my mistake. I just automatically hit the mute button on my side. Follow-up question then for both the mayor and Dr. de Villa. The Ontario government is gearing up to announce details about lifting some of the COVID safety restrictions. I'm wondering if the City of Toronto is ready to do the same. If so, what do you think would get lifted first in terms of the restrictions and when?
Well, I will start only because I'm going to indicate that whatever we do will be based on advice that comes from the Medical Officer of Health and will be consistent with provincial regulations. I think if you look, quite frankly, most of what is restricted now in one way or another is the subject of provincial regulation. We have some masking requirements, some indoor requirements in apartment buildings and other indoor spaces like that, but most of the requirements that are in place are provincial. And so we are obviously in close consultation with them all the time throughout the pandemic on these kinds of changes that might be had. I will say for myself that I'm listening carefully to what Dr. de Villa and others have to say, and that a continued, gradual but consistent approach is what I think continues to be called for, because while things are looking better, we have to make sure we protect that progress. But I think the vast majority of the changes that you would see taking place will be as a result of whatever the provincial plans are, more so than things we have in place, simply because they've had broader jurisdiction and because we, among others, preferred a province-wide or at least regional approach as opposed to every municipality having its own different policies within the reality of a region like this.
Yeah, not much more I can add to that which the mayor has said. Certainly, the vast majority of the restrictions or limitations, if you want to call it that, that are in place are under the provincial jurisdiction. This being said, we've heard today that, our numbers are looking pretty good. Indicators are stable and are trending, in the right direction overall over the past several weeks. However, this, to my mind, is reason for optimism, but with caution, exactly as the mayor said. We've seen in other jurisdictions, particularly with this Delta virus, how it does rapidly take advantage of circumstances. So when afforded the opportunity to spread, particularly when there are unprotected individuals, Delta variant so far the world over has taken that opportunity. I would be also remiss if I didn't point out that, look, we're at the point in the year where our weather gets colder, we move more indoors, and that gives rise to conditions for more transmission. So I would encourage people to continue the good measures that they've done for many months now, to get vaccinated if they haven't already been vaccinated, and particularly for those who are at higher risk for COVID-19 infection and serious infection with COVID-19, to continue to exercise some caution in order to reduce risk to themselves and to reduce risk to others around them.
Thank you. Next up, we have Oliver Moore from the Globe and Mail. Go ahead.
I hope you can all hear me while I change my setup since the mic check. I want to ask the mayor about the Rogers meeting yesterday. With all the demands on your calendar, given the pandemic, the economic recovery, why was it the best use of time or appropriate for the mayor of Toronto to be chairing a meeting that could decide the future of Canada's largest wireless carrier?
Well, I haven't really commented much on this and won't really comment on the substance of it at all. But I guess, I would say that I was in my office at 6 o'clock yesterday morning. I left to go to the meeting in question at 6 o'clock last night, having put in a full 12-hour day here. If I had a hobby, if I had some other kind of activity that I did, frankly, if I'd wanted to spend time with my family, I don't think after a 12-hour day anybody would deny me that opportunity. I choose to carry out a serious fiduciary obligation that I promised the late Mr. Rogers that I would do to try and help his family and his company. That's publicly known, and I've had opportunity to disclose that here many different times. I think it falls into the category of that everybody has some time that's their own, including mayors. I don't think anybody complains too much about the hours that I work each week, and I suppose if I want to devote a few hours, in this case 3 hours, to that, then that's up to me. And I'm quite prepared to be held accountable for that and for my work habits and for how many hours I work each week and for my full and complete absolute devotion. I can assure you that even during that 3 hours, if something had come up at the city that required my attention, because I was in full touch, of course, all the time, I would have dealt with that first. So I don't think there's too many people that call into question my devotion to my job.
I understand your desire not to comment on the specifics of this, but this isn't a private matter. It's a meeting pivotal in the future of a publicly traded company in the middle of a massive takeover. So I just add to that as a follow-up, a yes or no question. Do you back Ed Rogers' attempt to fire the CEO of Rogers and members of the executive team?
I think you should know better than to, and I say that with a smile on my face, than to think I'm going to answer that or any other question to do with the substance of this. These are private matters. Yes, it's a public company, and they will have to say whatever they have to say. I'm in a different capacity, helping the family as I have for many, many years, and I will continue to do that. I won't be making any comments on this of any kind whatsoever on the substance. I did answer your question about how I spend my own time, because that's a perfectly valid question to ask of me as mayor, but I'm not going to answer any other questions about that.
Okay, next up we have David Ryder from the Toronto Star. Go ahead. Oh, he's unmuted. Yeah, David, you might need to start over again. Go ahead.
Yeah, thank you. First question, I think, for Dr. de Villa. Dr. de Villa, we'll see the latest COVID numbers, I guess, later today when the dashboard is updated. You're probably privy to them. They have seemed to have come down despite kids back in school, despite Thanksgiving gatherings. I'm just wondering if you can comment on what, well, I guess, first of all, do you think, can we say now that we've smothered the fourth wave and anything that comes in future would be a separate wave? And what do you anticipate the impact of kids being vaccinated will do as far as getting us towards the end of the pandemic? How much of an impact do you think that'll have?
So David, thank you for the question. With respect to what we're seeing by way of trends, I've indicated that certainly our numbers are improving. And yes, the dashboard will be updated, and you will see that our 7-day moving average on new cases is trending downwards relative even to where it was last week, and that we're continuing to see improvements in our weekly incidence rate per 100,000. These are all good signs. However, we have not yet fully appreciated the impact of the Thanksgiving weekend. We have some of the data in, and certainly some of the activity that might have resulted from long weekend gatherings and get-togethers may already be manifest in our data, but I don't know that we can say definitively that we have the complete impact of Thanksgiving yet really appreciated or manifest in our data. So we are anticipating that yet. So I think I'd reserve judgment on, what the fourth wave is looking like at this point in time. I can say that as we are able to vaccinate 5 to 11-year-olds, that reduces the opportunity or, those who are extremely vulnerable to the spread of COVID-19, given what we know of the Delta variant. So I'm quite hopeful about the arrival of vaccines for 5 to 11-year-olds and what that means for us as a community with respect to overall protection and getting us to the other side of this pandemic. I don't know that I can be definitive around how soon that might be, but certainly every step that we can take to reduce COVID-19 transmission is a step in the right direction.
Thank you. And the follow-up is, I guess, also I think for Dr. de Villa, and that's, you mentioned the toolkit. We've seen some jurisdictions, including I think Hamilton, already releasing a fair bit of detail about what they're going to do to vaccinate as many kids aged 5 to 11 as possible. Can you tell us what's out there now? I don't know if the toolkit's being released yet, and what the timeline is for when parents and reporters will know exactly what the city's plan is for getting as many kids vaccinated as quickly as possible.
Yeah, so David, you should be seeing that very, very shortly. We're trying to make sure that resources are available for all those who need to know. Certainly our focus is going to be absolutely on parents, guardians, and caregivers, making sure that they have information to support conversations and decision-making within their own homes. And of course, we want to make sure that our provider partners are well-versed and ready to participate in this campaign. We've had great success, I would say, with our Team Toronto vaccination efforts to date. We've been working at this for many, many weeks as we knew that this vaccination would be coming, and certainly, we didn't know when, but we were quite hopeful to have vaccines for our youngest members of our community available later this year. And so we've been working on this for several weeks with our partners. So we look forward to putting out that information and making sure that good conversations can start happening in households and throughout the community, and as well amongst those who are healthcare providers and vaccination partners. Very much looking forward to this next component of the vaccine campaign, because as I said, it brings us one step closer to the other side of this pandemic.
Okay, and last question is Nicole Ireland from CBC. Nicole, we've unmuted you, so go ahead.
Hi, thanks very much. Dr. de Villa, you mentioned the multi-pronged campaign, and you mentioned that it may include school-based clinics. So I'm wondering, does that mean should parents expect that when their child goes to school, there will be a designated day or a couple days where they will be able to receive a vaccine in the course of their school day?
So Nicole, that's a great question. And I think, what I can say is that at this point, what will happen from school to school will vary a little bit. As you can well imagine, the circumstances from one school to the next are quite different. There are active conversations happening with our school board partners and schools themselves. Some are quite open to the possibility of clinics during the day, and part of this depends on what the physical layout and logistics of the school might be. Others have indicated that their preference for their unique circumstances and the needs of their community will look more like clinics in the after-school hours. So it will be variable, but it's not just about school-based clinics. We've talked about clinics that are available at doctors' offices, vaccine being made available through pharmacies, certainly through our mass immunization clinics and through community-based and or mobile clinics. So we are really working together as that Team Toronto approach to make sure that vaccine is available in as many channels as is possible and what makes sense for our communities to get our young people vaccinated quickly.
Follow up?
Thank you. That's a huge help. And on top of that, I would just ask, what specific challenges are you expecting to have to overcome when it comes to vaccinating young kids as opposed to the populations that you've previously vaccinated?
Well, I think when it comes to the vaccination of young children, obviously there are, issues around making sure that parents and the caregivers and guardians are informed with the resources or equipped with the resources that they need in order to make good decisions. So that certainly is one of them. I guess the other issue is, I bet it's been quite some time since I actually have personally delivered a vaccine to a little person. But as you can well imagine, and for those of us who are parents, there is, it still involves a needle, and this elicits some fear and anxiety for little people, and that's not always easy to deal with. So certainly providing some tools and tips and ensuring that our very practiced vaccine givers and administrators are prepared for that kind of circumstance is certainly one other challenge that's involved in administering vaccines to younger individuals. But I'm quite confident that we have resources available and certainly a wealth of experience amongst providers in our community who are used to giving vaccines to younger individuals. We're certainly going to be capitalizing on that experience so that we can have as successful a campaign as is possible.
Okay, that's it for today, everybody. Thank you and have a great rest of your week.